Imagine a disease so dreadful, so insidious, that it makes its victims panic at just the thought or even the sight of a drink of water.
It's hard to even comprehend.
Yeah, we're talking about rabies, a virus that's, well, it's captivated and terrified humanity for literally millennia. Our goal isn't just to list facts, but to really extract the most important nuggets of knowledge, from its basic biology all the way to the chilling evolutionary logic behind its most horrific symptoms.
It really is a fascinating, though grim, study.
Definitely.
And, as medical professionals, we deal with diseases with high fatality rates, but rabies, it really stands out. It's got a near 100% fatality rate when symptoms appear, about 100%. Yet it's also almost entirely preventable with timely intervention.
That contrast is stark.
It is, and there's just so much to understand about this virus's very specific, almost strategic logic. It's quite something.
Exactly. And that's what we really want to unravel for you today. We'll specifically explore its cunning spreading mechanisms.
Yeah.
And then crucially, dive deep into the fascinating but deeply unsettling neurological roots of that signature symptom, hydrophobia.
Yeah, the fear of water.
Get ready for some truly surprising facts that really highlight the virus's almost malicious design, wouldn't you say?
Malicious by outcome, certainly.
Yeah.
Driven by evolution.
So let's start at the beginning. From a clinical standpoint, what exactly is rabies at its core? How does this, microscopic threat generally make its way to us?
Okay, so at its core, rabies is a deadly viral disease. It causes encephalitis, that's a severe inflammation of the brain, and it affects humans and other mammals.
Encephalitis, right.
It's primarily caused by the rabies virus, which is a type of Lyssavirus. That's a family of viruses kind of notorious for targeting the nervous system.
Okay.
And transmission. It typically occurs when infected saliva from an animal gets into a person's body. Most often, that's through a bite.
Right, the classic bite scenario. Now, when we think of rabies, our minds often jump straight to rabid dogs, and globally, that holds true.
Overwhelmingly true, globally.
But your sources tell us the picture is actually much more nuanced, especially depending on where you are in the world. What does the data show about the main carriers?
That's a really crucial distinction. Globally, yes, dogs are involved in over 99% of human cases. Huge number.
Wow.
However, in regions like the United States and the Americas generally, the landscape shifts dramatically.
How so?
Here, bats are actually the most common source of human infections.
Bats.
Yes, bats. And the silver-haired bat is specifically highlighted as a dangerous threat. Less than 5% of cases in the Americas actually come from dogs anymore.
That's a huge shift in perception versus reality for many people.
It really is.
Okay.
And other significant vectors in the U.S. include coyotes, foxes, raccoons, skunks.
The usual suspects in wildlife.
Pretty much.
Okay.
And then there's a whole range of other mammals that can carry it. Cats, cows, ferrets, goats, horses, beavers, monkeys, woodchucks, bears, other wild carnivores too.
So while that image of the rabid dog persists, a bat encounter is statistically much more concerning in North America. That's a key, potentially life-saving point for you listening.
Absolutely critical awareness.
And it's not just bites, is it? As clinicians, we know the virus has other ways in, maybe less obvious ones.
It does. Bites are definitely the main route. But infected saliva can also transmit rabies if it gets into open wounds or mucous membranes, like your eyes, mouth, or nose.
So even a scratch?
Potentially. For instance, a bat's saliva might, say, drool onto a minor open cut, or an infected animal might lick broken skin. That's why we always stress that any potential exposure needs to be taken seriously.
Right.
Interestingly, human-to-human transmission is extremely rare. Like incredibly rare, only documented in a handful of cases, and those were through organ transplants, mostly corneal transplants.
Okay, so casual contact isn't a risk.
No, definitely not. Touching a person with rabies or contact with urine, blood, feces, that does not constitute exposure. And here's something else your sources mentioned that might surprise you. Small rodents.
Like mice and squirrels.
Exactly. Mice, rats, squirrels, also rabbits and hares. They're almost never found to be infected or to transmit rabies to humans.
Why is that?
They're typically killed by the rabid animal during the encounter. They don't usually survive long enough to pass it on. Even Virginia opossums, they're quite resistant because they have a naturally lower body temperature.
Fascinating. So a big relief regarding small rodents, but that bat warning is critical.
Okay, so once this microscopic invader gets inside, it doesn't just sit there. It takes this chilling, very precise journey, almost like it has a map straight to the brain's command center. how does it actually take over and cause such devastation?
It's an incredible journey, really, highly orchestrated, and it truly showcases the virus's specific intelligence, not conscious intelligence, obviously, but evolutionary programming.
The rabies virus is neurotropic. That means it specifically targets nerve cells. And crucially, it travels exclusively along peripheral nerves. It completely bypasses the bloodstream.
No bloodstream, just nerves.
Just nerves. Initially, it often infects muscle cells right near the bite site. It replicates there quietly, kind of under the radar of the immune system.
Stealthy.
Very. Once it's replicated enough virus particles, it binds to specific receptors, acetylcholine receptors, at the neuromuscular junction. Think of those as the docking points where nerves talk to muscles. That's its entry key into the nervous system itself.
So it hijacks the normal communication point.
Precisely. And from there, it travels rapidly upstream. We call it retrograde transport.
Backwards along the nerve.
Exactly. Like a specialized express train moving backward along the nerve fibers, the axon, heading straight towards the nerve cell body, then onto the spinal cord, and finally reaching the central nervous system.
The CNS.
Right. There, it replicates in motor neurons and eventually infects the brain itself.
And once it's in the brain...
Once the brain is infected, the virus then travels centrifugally. That means outwards from the center. It goes out to the peripheral and autonomic nervous systems and eventually migrates to the salivary glands.
Ah, the salivary glands. Ready for transmission.
That's the crucial endpoint for the virus's life cycle. It's now positioned perfectly to be transmitted to the next host, completing its morbid journey.
What's truly fascinating and frankly deeply disturbing here is that it's not just a passive infection spreading. The virus seems to actively manipulate the host for its own survival. Like you said, it's almost like a malicious strategist with this horrific evolved logic.
You've absolutely hit on a key insight there. While we don't ascribe intelligence like consciousness to a virus, what we see is this remarkable evolutionary intelligence. It's been meticulously forged by natural selection over millennia.
Survival of the fittest, or perhaps the nastiest in this case.
You could say that. The variants of rabies that happen to produce symptoms promoting viral spread things like frothing at the mouth, aggression, increased biting, and importantly, hydrophobia. Those were the variants that successfully got passed on.
And the others died out.
Exactly. Variants that just quietly killed the host without making it likely to bite or spread saliva, they simply didn't propagate as well. They hit an evolutionary dead end.
So the virus essentially evolved to target and mess with specific brain areas.
Precisely. It evolved to specifically target and disrupt the swallowing and breathing centers in the brainstem.
Why those areas?
Well, think about it. This ensures that saliva, now loaded with virus, accumulates in the mouth, the frothing and drooling. It prevents the saliva from being diluted by drinking water.
Ah, hence the hydrophobia link.
Exactly. And it significantly increases the chance of transmission when the infected, agitated host bites another animal. Plus, the induced restlessness, anxiety, agitation that also directly contributes to increased biting behavior.
It's natural selection's most brutal yet chillingly effective algorithm for ensuring its own survival.
That's a very good way to put it.
And this sophisticated genetic programming, it inevitably leads to these incredibly severe symptoms, amplifying the patient's suffering in really unique and awful ways.
Absolutely. From a clinical perspective, the incubation period, the time between exposure and symptoms, is typically 1 to 3 months in humans.
But it can vary wildly.
Oh, dramatically. It can range from less than 1 week to incredibly more than 6 years.
6 years, wow. What influences that?
Key factors are things like the wound's location closer to the head means a shorter path to the brain.
Makes sense.
The severity of the wound and the amount of virus introduced initially. A deep bite with lots of virus near the head will likely have a much shorter incubation period than a minor scratch on the foot.
Okay, so what are the first signs, the things we'd initially look out for in a patient who might have been exposed?
Well, that's part of the challenge. The early symptoms are often really nonspecific. They can easily be confused with other common illnesses.
Like the flu.
Very much like the flu. You'll see fever, headache, maybe some general malaise. These might last for several days. Unfortunately, this makes early diagnosis quite difficult for clinicians based on symptoms alone.
But then it progresses. It shifts into something far more sinister, with symptoms that make it, well, a truly dreadful disease to witness.
Yes. As the disease progresses and the virus really takes hold in the central nervous system, the signs and symptoms become much more severe and characteristic.
What kind of things?
Patients may experience nausea, vomiting, significant agitation, anxiety, confusion, hyperactivity. It's a profound neurological disturbance.
And the physical symptoms?
They develop difficulty swallowing. That's dysphagia, which leads to that excessive salivation. You might also see partial paralysis, hallucinations, and insomnia.
And your sources mentioned 2 main forms.
That's right. Rabies generally manifests in 2 main clinical forms. Furious rabies affects about 80% of patients. That's the one marked by irrational aggression, uncontrolled excitement, and that accumulation of saliva causing the foaming at the mouth.
The form that aids transmission.
Exactly. It directly helps spread the virus through bites. The remaining 20% or so experience paralytic rabies, also called dumb rabies. This is characterized more by muscle weakness, loss of sensation, and progressive paralysis. This form typically doesn't cause hydrophobia.
Okay, and this brings us to its most infamous, most terrifying symptom, hydrophobia. We hear the term, but the neurological reality. It's far more agonizing than just a simple fear of water, isn't it? What does that truly mean for the person experiencing it?
You're absolutely right. It's critical to understand hydrophobia is not a psychological fear in the way we usually think of phobias. It is a profoundly distressing neurological symptom.
Neurological, not psychological. Got it.
The virus heavily infects the brainstem. Specifically, it targets the nuclei controlling essential functions like swallowing that involves cranial nerves, IX and X, the glossopharyngeal and vagus nerves controlling throat muscles, and also breathing.
And it affects emotions, too.
Yes, it also inflames and disrupts the limbic system, which is the brain's emotional processing center.
So what happens when they try to drink?
When an infected person even attempts to swallow water, the muscles in their throat and larynx spasm violently, painfully, excruciatingly.
Oh, wow.
The nervous system becomes so hypersensitive, so hyperreactive, that eventually even the sight of water, the sound of it splashing, or even just the thought of drinking can trigger these agonizing spasms.
Like a conditioned reflex from hell.
That's a good description. The brain essentially learns to associate water with this intense trauma, creating pathological, almost Pavlovian conditioned reflex loop. It extends to other things too, like aerophobia.
Fear of air.
Yes, where even a draft of air blowing on the face can trigger similar hypersensitivity and spasms.
The suffering must be immense.
It is, and what makes it particularly cruel is that the disease often leaves the patient's awareness largely intact, especially in the furious form, until the very late stages.
So they're aware of what's happening.
They are consciously suffering, aware they can't drink, choking on their own saliva, living in this continuous state of panic and dread as seemingly harmless sensory stimuli constantly trigger these awful spasms. Physicians historically called it the most dreadful of all diseases, for a very good reason.
It sounds truly agonizing, but... And this is the crucial turning point in our understanding. Despite its horrific nature, once symptoms start, there is genuinely good news about prevention. This is where medical intervention is absolutely vital, isn't it? A true triumph of modern medicine.
Exactly. That's the most critical message. The good news is that rabies is almost entirely preventable. Now, diagnosis in the early stages, as we said, can be tricky because the symptoms mimic other things.
Right.
The gold standard, the reference method for diagnosis, is still the fluorescent antibody test, the FAT test, which is done on brain tissue samples, usually post-mortem.
After death. But are there advances?
Yes. Newer techniques like RT-PCR, which detects viral RNA, and the CDC's LM34 test are improving diagnostics. They can even work on decomposed samples sometimes, which is really important in real-world investigations.
Okay. But the truly vital message here for you listening right now is that rabies is preventable. What practical steps can you take to protect yourself, your family, your community?
Prevention really starts with awareness and responsible animal care. First and foremost, ensure your pets, dogs, cats, ferrets are vaccinated against rabies. That's paramount.
Keep those vaccinations up to date.
Absolutely. And keep pets confined or supervised when they're outdoors to minimize contact with wild animals. Small pets like rabbits and guinea pigs, they can't be vaccinated, so keep them safely indoors or in protected cages.
And interacting with wildlife.
Never approach or handle wild animals, especially if they seem unusually unafraid or behaving strangely. That's a major red flag for rabies or other diseases.
What about bats in the home?
That's a big one, especially in the US. Seal cracks and gaps where bats could potentially enter your house. If you do find bats inside, don't try to handle them yourself. Call an animal control or wildlife expert.
Good advice. And for certain people, there's pre-exposure vaccination.
Yes, pre-exposure prophylaxis, or pre-EP, is recommended for people at high risk. That includes people traveling for extended periods to countries where rabies is common, veterinarians, animal handlers, lab workers.
People likely to encounter the virus.
Exactly. And it's worth mentioning World Rabies Day, September 28th, which promotes these global prevention efforts. And these efforts work. Vaccination campaigns, including clever strategies like distributing oral vaccines in baits for wildlife.
Like leaving medicated treats out?
Sort of, yes. These have dramatically reduced rabies in many areas. Think Canada, Switzerland, Italy. They've had great success with wildlife vaccination programs.
That's really reassuring progress. But okay, worst case scenario. Someone suspects they've been exposed. A bite, a scratch, maybe just finding a bat in the room. Immediate action is absolutely critical then, right? What should you do? What's the protocol?
Yes, time is absolutely of the essence here. If you are bitten by any animal or potentially exposed to a suspected rabid animal, you need to seek immediate medical care. No waiting.
And that includes situations where you're not sure if a bite occurred.
Absolutely. And this is a key insight for everyone listening. This includes situations like waking up to find a bat in your room, even if you don't see a bite mark, or finding a bat near an unattended child, or near someone with a disability who couldn't report a bite.
Why is that so critical?
Because bat bites can be tiny, almost invisible like a pinprick. In those scenarios, you must assume exposure has occurred and seek immediate medical care. That caution can be life-saving.
Assume exposure. Got it. What's the first aid?
First, immediately and thoroughly wash the wound with soap and water. Really flush it out for about 5 minutes if possible. Then apply an antiseptic like povidone iodine or alcohol.
And then straight to medical care for.
So post-exposure prophylaxis, or PPIC. This is the crucial intervention. It typically involves a series of rabies vaccines and, importantly, sometimes human rabies immunoglobulin, or HRIG.
What's HRIG?
Think of HRIG as giving you immediate ready-made antibodies against rabies. It provides instant protection right at the wound site and systemically, while your body starts building its own long-term immunity from the vaccine series.
So it buys you time for the vaccine to work.
Exactly. And PPIC, when administered correctly and before any symptoms appear, is nearly 100% effective at preventing rabies.
That's an incredible success rate.
It truly is. The typical U.S. protocol involves 1 dose of HRIG, usually given into and around the wound if possible, and then 4 doses of the rabies vaccine given over a 14-day period.
And let's bust that old myth. These aren't painful shots in the stomach anymore, right?
Definitely not. That's a very outdated fear. Modern rabies vaccines are intramuscular injections, usually given right in the upper arm muscle, like many other common vaccines. Much less uncomfortable.
That's good to know. But what if someone doesn't get PEP in time? What if symptoms develop?
Unfortunately, once those neurological symptoms appear, rabies is almost certainly fatal. Treatment at that stage becomes primarily palliative care managing symptoms, providing comfort. While there have been some experimental treatments attempted, like the Milwaukee Protocol,
I've heard of that.
they have, by and large, been unsuccessful in saving patients once symptoms are present. Prevention through PAP is really the only reliable defense.
So zooming out again on a global scale, considering everything we've discussed, what's the broader impact of rabies today, and what are the big picture efforts to combat it?
Globally, rabies remains a major public health challenge, particularly in certain regions. It causes an estimated 59,000 deaths worldwide every single year.
59,000, that's a staggering number.
It is. And tragically, about 40% of those deaths occur in children under the age of 15.
Oh, that's heartbreaking.
It is. And over 95% of all human deaths from rabies happen in Africa and Asia. That's where the burden is heaviest.
Why the disparity?
Often due to challenges in implementing widespread dog vaccination campaigns, limited access to timely PEP for bite victims, and sometimes lack of awareness. Dogs are still the main source in those regions.
So what's being done?
Well, the World Health Organization, along with other global partners like the World Organization for Animal Health and the FAO, has set an ambitious but critical goal: 0 by 30. They aim to eliminate human deaths from dog-mediated rabies by the year 2030.
0 human deaths by 2030. That's a huge goal.
It is, but it's achievable with concerted effort. Right. We have the tools: effective vaccines for dogs and humans, effective PEP. Countries like the US and Mexico have successfully eliminated dog-transmitted rabies within their borders, showing it can be done. It serves as a model.
But it remains endemic elsewhere.
Yes, it's still endemic in many parts of Asia. India, Cambodia, the Philippines, Thailand, for example, and much of Africa, largely due to the challenges in implementing those control measures consistently and sustainably.
Right. So we've taken quite a deep dive today into the really complex world of rabies. We've explored its journey through the body, the terrifying neurological roots of hydrophobia, and crucially, the steps for prevention and treatment. It's a disease shaped by this almost unbelievable evolutionary cunning.
I think the most important insight, the key takeaway from our deep dive today is this. While rabies is an incredibly brutal, almost universally fatal disease once symptoms show up,
Terrifyingly so.
it is also one of the most preventable infectious diseases we know of if swift, appropriate post-exposure care is given. Awareness, responsible pet ownership, avoiding wildlife contact, and immediate action after potential exposure. These are truly life-saving.
Absolutely. Prevention is everything here. And maybe a final thought for you to ponder. Think about this tiny virus. Through countless generations of just blind evolutionary trial and error, it has perfected this algorithm to hijack a complex mammal's nervous system.
It's remarkable in a chilling way.
Yeah, turning its most basic survival reflexes, swallowing, even social behavior like aggression, into tools for its own transmission. It doesn't think, yet it achieves such a precise, horrifying outcome. It makes you wonder, what other invisible architects might be shaping life around us in equally profound, maybe unsettling ways, all through that same ruthless logic of natural selection?
A sobering thought.
Definitely something to think about. Thank you for joining us for this deep dive. Stay curious, stay informed, and we'll see you next time.